This patient has got multiple uterine fibroids. We are going to do laparoscopic myomectomy. You can see this is purely a pedunculated large subserous fibroid, and there were many intramural fibroids also. All the fibroids were removed meticulously. This patient is an alliparous female. So first we are injecting vasopressin, diluted vasopressin, 1 ampule diluted into 200 ml solution, and injecting at the proper plane. So you can see once injected, the uterus and the fibroid, everything gets blanched out, and this is a bipolar instrument, vessel sealing. We just seal the pedunculated part, and the fibroid is totally detached, and we'll keep the fibroid away from the operating area, and we'll go for the next fibroids. So this is purely a subserous and pedunculated. This is another subserous fibroid, the second fibroid which we have removed, and we are keeping it in the pouch of Douglas. This is another fibroid close to the cervix. So again we are injecting and trying to go into the proper plane. This fibroid is actually projecting into the broad ligament. So once you are going into the plane, if you give a good traction by using a myoma screw, most of the time these fibroids will get enucleated. And here the problem is you have to be very careful not to injure the uterine artery as well as ureter. So once you come to the base, you can apply a little bit of bipolar energy, and you can divide it by using harmonic scalpel. This is another fibroid. This is intramural. It is close to the cornu on the left side, and we made an incision, introduce the myoma screw into the fibroid, and remove that fibroid also. So all the fibroids were removed, and now we are closing. This is 15 centimeter bobbed suture. Since it is a small incision in the muscle layer, we are closing like a normal suture. Otherwise we will use suture like a baseball suture, like suturing. The suturing is almost done. We are locking it and cutting it. Similarly, all small incisions will be closed meticulously so that there is no weakening of the uterine wall. This is close to the broad ligament on the left side. And finally, we are suturing this small muscular defect. This is not a full thickness, this is just a partial thickness. injury, cut to the muscle. Now we are using a oscillator to retrieve the specimen. You can modulate within the bag also. So if you are suspecting some pathology, you can put the specimen into a bag and you can modulate. So this blade got 15 mm and 18 mm. So here if the specimen is large, we prefer to use 18 mm diameter blade so that this will come with few cuts. The specimen will be retrieved with few cuts. So now we can see the appearance. This is the final appearance. You can see almost all the anatomical structures are brought back into its original shape, and it looks like a normal uterus. Both the tubes and ovaries are also normal. Thank you.